Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a healthcare damage report, and a success story to send us into the week. The most urgent headline in Rural Health News is a recent report from Gerard's 2025 National Community Benefit Survey. According to their poll, 69% of the public agrees that hospitals in the United States are mostly focused on making money versus the alternative option that hospitals are in fact mostly focused on caring for patients. We consider this finding the most urgent news item today because of the alarming nature of public sentiment against hospitals. While there are many health-related organizations that do not have patients' best interest in mind, they do exist. Hospitals do not exist to simply make money. Both nonprofit and for-profit hospitals rely on state and federal payments to some degree, and often hospital administrators are focused on covering the cost of care without completely losing their margins. Some hospitals completely lose their margins. The healthcare payment system is an imperfect system and certainly may involve some profit-focused parties, but hospitals and healthcare providers are not set up to benefit from the system. And hundreds of community-first hospitals in rural areas have closed their doors because they can't operate on the non-negotiable reimbursement rates. The purpose of addressing this issue is to draw awareness to misinformation that may be influencing public opinion. Our hope is that by educating our audience, our listeners, we can shift the focus from the idea that hospitals are profiting from payment systems to how we as a nation can improve access to healthcare and provide communities with services they desperately need. Now on to the damage report. The Trump administration recently proposed a rollback of a Medicaid payment policy that gives states flexibility in state-directed payment rates. Since the policy was first enacted during the president's first term, it has been crucial for hospitals serving high volumes of Medicaid patients, especially in rural communities. Without this policy, many hospitals will see the gap between cost of care and reimbursement grow dangerously wider. Some states are already seeing delayed supplemental payments from Medicaid. Rolling back the policy will threaten access to health care across this country. And with the bleak future of Medicaid's budget already in play, it's clear those cost gaps won't be covered by federal funding. In other news, RFK Jr., Health and Human Service Secretary, announced he is dismissing the entire Vaccine Advisory Committee, which was already under scrutiny by the current administration. This panel has been considered a reliable source of expertise on the safety of vaccines for decades. And now the uncertainty politicization of health has led to what Dr. Celine Gounder from KFF Health News calls politics, partisanship, and ideology being inserted into science. For today's success story, we're going to visit Michigan, home of Hillsdale Hospital, with the hope that this success story will be repeated in many other states. Earlier this month, a bipartisan group of lawmakers introduced legislation to address violence against healthcare workers. According to the U.S. Bureau of Labor Statistics, healthcare workers are 5 times more likely to suffer an injury from violence in the workplace than workers in other industries. The current law, passed in 2023, is that individuals who commit acts of violence against healthcare workers are going to be subjected to prosecution. This bill proposes stronger penalties for aggressors and addresses deeper behavioral issues by creating an assisted outpatient treatment pathway to provide mental health support for individuals who engaged in violent behavior against healthcare workers. The Michigan Health and Hospital Association has been a strong advocate of this bill, and we hope to see it become law for the sake of every staff member and every volunteer in our healthcare setting. Thank you to our sources for this episode: Gerard, Becker's Hospital Review, the U.S. Bureau of Labor Statistics, KFF Health News, and the Michigan Health and Hospital Association.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.